half of all women have dense breasts, and not only does that make it difficult for doctors to diagnose breast cancer, but it can actually put those women at greater risk of the disease. And joining me today to talk about this issue is Dr. Linda Frye, who is Medical Director of the Margaret W. Needland Breast Center at Jupiter Medical Center. Dr. Frye, thanks for joining us today.
Thank you for having me.
So tell me, what are dense breasts? What does that mean, and how is density actually measured?
It's a great question. So breast tissue density is something that the radiologist is going to tell you based on what they see on the mammogram. It's not something that you're going to feel. It's what we see as far as a mixture of fatty tissue and fibroglandular tissue. And for us, there's 4 categories of breast tissue density. There's somebody who is fatty replaced, and that's going to be somebody that's very easy to interpret. Fibroglandular tissue is white, and cancers are white. So the more background of white that you have, the harder it is for us to find a breast cancer in that patient's breast. So then we have scattered, and that's going to be about a little bit more than fatty, about 25% more. So then the latter 2 categories are heterogeneously dense and extremely dense. And so when you have more white fibroglandular tissue, again, harder to find a cancer in that kind of a breast. You can think of it like a glass of milk and water. So you can take a grape or something and drop it into the water. You can see that easy, and that's a fatty replaced breast. A glass of milk, just milk and not diluted out, when you drop a grape in, that's going to be a breast that's hard to find a cancer in.
So we're talking about fatty tissue in the breast. I mean, is that only heavy women who have dense breasts? Could someone who's very fit and thin also have dense breasts?
Absolutely. So it's more of your genetic makeup. If what I tell people when they ask me, they'll say, "Well, I have dense breast tissue. How did I get it?" Well, likely their mother has dense breasts. Likely their sisters have dense breasts. It's your genetic makeup. Things that can influence your breast tissue density are your overall body habitus and how much overall weight you have, because it is a combination of fat and functional breast tissue. Also, if somebody takes hormones after menopause, that can increase your breast tissue density by stimulating your breast tissue, your functional breast tissue.
And now, why is it important for women to know whether or not they have dense breasts and how dense their breasts are?
So knowing that you have dense breast tissue is important because you want to know what the limitations are for mammography. Even though mammography is the gold standard and you want to never forego your annual mammogram, you may need to ask your doctor for additional imaging prescription, like for ultrasound, because that's going to help us look through your dense breast tissue and try to find a small cancer that may not be seen on the mammogram. Also, having dense tissue, you have a 4 to 6 time increased risk to having breast cancer or developing breast cancer.
So can you explain that to me? Because I think a lot of women are probably aware that dense breasts actually makes it harder to see a cancer, but a lot of women may not realize that that condition itself puts them at greater risk of developing the disease. Why is that?
That's something that's being looked into. I don't think anybody really knows exactly why, but how I think about it, it may just be because it's more stimulated, it's more dense, it's more stimulated. Maybe one of the reasons why it puts somebody at increased risk.
And what are you doing at the Margaret W. Needland Breast Center when you see a new patient and realize that they have dense breasts?
So we are giving same-day results at the Women's Center. So when somebody has the 3D mammogram, which is the only type of mammography that we'll do over at the Women's Center because it is such a valuable tool in finding early breast cancer. When we do a screening mammogram, we'll go and talk with the lady, and we'll let them know that your mammogram looks great, you do have dense breast tissue. They'll usually that'll be a conversation about what that means, since that may be the first time they're hearing about it. And we'll offer them an ultrasound if they wanted to go ahead and pursue that today, or come back when it's more convenient for them, but we do inform them about what that means.
And so what sort of screening do you recommend for women with dense breasts? What should they be pursuing? What's the standard when a woman with dense breasts goes for her annual exam?
So you won't actually know what your breast tissue density is until you have a mammogram. That's something that a radiologist will see on the films. And what it actually is, it's a mixture of fatty tissue and how much dense fibrous tissue you have. For us, it's 4 categories. It's going to be what's called scattered, well, fatty, replaced, scattered, heterogeneously dense, and extremely dense. And that whole spectrum is how much fat you have in the breast to fibrous tissue. So somebody who's extremely dense, it's going to be hard to find a little cancer in this background of white because cancers are white. And a patient who has fatty breasts, it's going to be quite easy to find a cancer because it's almost a see-through. So it's that spectrum of breast tissue density, which for us determines how hard it is to actually find a cancer. The heterogeneous and the extremely dense, the last 2 categories, it makes up about 50% of women.
50% of women have dense breasts.
Yes, and it's not going to be something that you know of on physical exam. Like we'll have patients come in and say, oh, I know I have dense breast tissue because it feels lumpy, but you do the mammogram and they're actually fatty replaced. So it's not something that you're going to know. It's only something that we're going to be able to tell you.
If a woman has dense breasts, how much more likely is she to develop breast cancer?
Actually, it's 4 to 6 times more likely to develop breast cancer.
That's a frightening statistic. So what should women with dense breasts be doing?
Being your own advocate, not only asking for your annual screening mammogram prescription from your doctor, but also saying, you know, I have dense breast tissue, let's add an ultrasound onto that.
So women need to advocate and be asking for additional screening.
You know, until all physicians get on board, then yes, I think women definitely need to be their own advocate.
I understand that there's a movement across the country to make sure that hospitals and mammography centers and things are informing women of their breast density. Can you tell me a little bit about what's happening out there in states across the country?
So the first law was passed in Connecticut for informing women of their breast tissue density, and that has been adopted in 29 states to date. Currently, Florida is one that it's a bill that's in motion, but currently not passed.
And what are your hopes for Florida? Do you think that it is going to pass? Is this controversial in any way?
You know, not for radiologists, not for mammographers. I think we all know the value of adding ultrasound and looking through that dense breast tissue. So I think for us, definitely it's not a question. I strongly recommend ultrasound for dense breast tissue, even though the odds of finding a cancer are not high. It may be 6 out of 1,000, but for those 6 women, it matters. And I only get one time a year to tell somebody that they're good. So I want to maximize, you know, and I want to be right, that when I say you're good, I mean it, you're good. I don't see any evidence of breast cancer. I would hope that insurance companies would step up, and women with dense breast tissue, they would cover an ultrasound as a screening exam and not put it towards their deductible, which sometimes can be cost prohibitive, and that would be a shame.
So yes, let's talk about the insurance because that's so important to everyone. Is screening mammogram covered today by most insurance plans? And then what about ultrasound or additional testing? How is that handled under insurance?
Right, ultrasound goes towards somebody's deductible. I know at the Margaret W. Needland Breast Center, though, we do offer a cash price for screening, and there's some pluses and minuses to that, but it still, I think, is pretty competitive where at least the patient could get that extra exam and have some peace of mind.
Is it important where a woman goes to get their mammogram, and what should they be looking for when they're going to choose a center or a place to have mammography?
So what is helpful is to look at what kind of equipment they have at the center. That's one thing. We have 3D mammography at the Margaret W. Needland Breast Center. 3D mammography finds 41% more invasive cancers just because of the sheer fact I can go 1 millimeter at a time through the breast instead of one stagnant picture. It really breaks it up into 1 millimeter increments in each of the 4 views. And that's no more radiation than just a regular 2D mammogram. So having good equipment, a center that's accredited, you want to make sure that your technologists are doing a lot of mammograms, not a radiology technologist that's maybe doing a colonoscopy and then comes over and does a mammogram, or or whatever. Maybe not having a technologist do other kinds of exams and then coming back and doing an occasional mammogram. So excellent positioning is something that is second to none. You need excellent positioning. And then who's reading your films? You want to have, I would imagine, a board certified radiologist with a subspecialty in mammography is found to find smaller cancers. So it matters what kind of equipment you have, who's positioning you, and then who's reading your films.
So tell me, I understand at the Margaret W. Needland Breast Center that, there's the radiologists, people like yourself, breast imaging specialists, but there's a whole team there. Tell me about the team at the Needland Breast Center and the resources that you bring to women.
I'm really proud of that. I think that I've been here for now 2 years, and I've watched a whole team morph around our patient and their needs. So we could have a patient come in for a screening mammogram and we'll see an abnormality on her films. I'll go ahead and talk with her and we'll move her right along through a diagnostic. And if it's an ultrasound finding, I can go ahead and do the biopsy right then. Also, patients where I can look at their family history and I can see that she may have a genetic propensity for what I think is going to be a cancer. She can go right upstairs and see Kathy Marinac, our genetic counselor, and start that piece of the puzzle. I'll also get in our nurse navigator and our social worker, especially if they have issues with maybe their insurance. So those are, or personal situation going on. So having a whole team is incredibly valuable to patients as they're doing their walk. It can be very overwhelming, but we have a team that comes along beside a lady and carries her all the way through her treatment and then beyond.
As a breast imaging specialist, are there any developments that you see on the horizon for breast cancer that you think are promising or that women should know about?
For breast cancer, Another thing that I'm very proud of at our center is how we're treating small breast cancers, oftentimes with intraoperative radiation therapy. So a patient can go to the operating room, have her surgery taken out, during surgery have her cancer taken out, and then have radiation and wake up and kind of be done with her treatment there and having it, instead of having it stretched out over 6 weeks. And that's very cool. What I'd like to see at the Women's Center, I think what I'd like to next adopt is doing fast MRI sequencing, so we can maybe offer that to more patients at a lower cost and get even more women screened that need to be screened, who have dense breast tissue and who have family history.
Wonderful. Well, Dr. Linda Frye, Medical Director of the Margaret W. Needland Breast Center at Jupiter Medical Center, thank you so much for joining us.
Thank you.